Good afternoon. New Mexico is on the brink of a medical crisis. Thousands of doctors need to be hired soon, or else waits to see a doctor could be a lot longer than they already are. News 13's Lizzie Mitri is live in the Newsplex with more.
Kim, the findings were released in a legislative report lawmakers discussed in Santa Fe today. A legislative audit report shows there's a growing shortage of doctors and nurses in New Mexico, and it could mean longer waits if nothing is done to change it. Today, the Legislative Finance Committee discussed the report that says the state is short an estimated 2,000 doctors. Dr. Michael Landon says you can especially see the effects in rural New Mexico.
Diabetes care, asthma care. People in rural areas are more likely to have to go to the ER for that care as opposed to a primary care healthcare provider.
That's why the state is looking at recruitment incentives, particularly for people from those rural areas likely to stay and practice medicine there. Additional funding to help fill the gap could come from the Federal Affordable Health Care Act.
We have an opportunity here with the Affordable Care Act to increase the percentage of New Mexicans that are insured. With that brings more resources to our healthcare systems.
Other solutions include more nurse practitioners to make up for a lack of primary care physicians.
Most of us are healthy. Most of us don't need a lot of health care. We need some health guidance. We need health assessments.
The executive director of the state's Center of Nursing Excellence says state investments currently focus on associate degree nursing programs. She says the desire for more nurse practitioners means more students need to advance their education with bachelor's and master's degrees.
First, it's put a constraint on the ability for nurses to move forward to those advanced degrees. So it's discouraged a lot of nurses from doing those kinds of things, and for those who persevere, we've made it harder for them.
Even as the state looks to nurse practitioners as a solution, the report shows there's a shortage there too of at least 240 professionals. Kim, back to you.
Okay, thanks, Lizzie. The report shows the state has about 3,000 fewer registered nurses than the national average. And New Mexico saw a drop in nursing degrees between 2007 and 2011, despite millions of dollars of state funding for the programs.